Good Monday morning and welcome to the Oakland County Megacast. I'm Tyler Keefe in the studios of Civic Center TV and 89.3 Lakes FM. In addition today, as always, we are on 88.1 WBFH, The Biff, and on Birmingham area municipal access. Today we are also broadcasting live via Facebook on the Facebook page of Oakland University. And as always, joining me from her home studio in Keego Harbor is Ronnie Dahl.
Tyler, the weekends go by too darn quick.
They do. They really do.
I don't know who came up with the Monday through Friday work week, but if they were sitting in front of me right now, I'd hit them upside the face.
Yeah, you know what?
We need 4-day work weeks.
We don't condone violence here at Civic Center TV, but if you were to do that, when they react and their head turns the other way, I'm going to go and smack them across the other side of their face, too. That's a terrible idea, and they are a scoundrel.
Hey, great to have everyone with us on this Monday morning. And the weekends do go by very quick, but what a weekend as well as that, because we had a $1 billion lotto winner right here in Metro Detroit. They bought the ticket at the Kroger and a Novi. And you know what, though, Tyler, while my husband was absolutely devastated that it wasn't us that won, I will say I was almost giddy knowing that that ticket was sold here in the Metro Detroit area, because I felt like it's getting closer. It's getting closer to us, but we're also hoping that that money love kind of filters down to some of the people here in the community. But on top of that, too, I really hope that the winner is someone that has either been on the front lines of this crazy COVID crisis, or they were on the brink of losing, their home, or really struggling financially during this time as well. That would be great, but we should be finding out at some point in time who the winner is, because they cannot remain anonymous when it comes to this actual lottery system. So we'll find out who they are eventually, and I might be their long lost cousin.
Maybe. Now, see, that's the thing about that was last week they had a couple of big Mega Millions jackpots. And, of course, the first one was won by someone in Maryland at a very small-town grocery store. And then the second one over the weekend, the $1 billion jackpot, was won by somebody in Novi, which I was so close. Not because my numbers were close. My numbers were nowhere near that. But because I bought my lottery ticket at that Novi grocery store, at the Novi Kroger, I just had the wrong numbers. It was just the wrong timing. I was there I was probably there a few hours too late, a few hours too early. I don't know. People were my family was calling me after that, and after that news broke, and was like, "Oh, was that your ticket? Were you the ticket from the Novi Kroger?" I'm like, "Yes, I was the ticket from the Novi Kroger. I just wasn't the winning one."
Oh my God, what was that like, though? To be like, wait, I bought a lotto ticket from there. I'd be like crazy.
I was a little crazy at first. I'm like, wait a minute, I thought I saw a 24 somewhere on that card. Let me take a look, and I took a look, and I'm like, no, there's no 24 in the Mega Ball part. So I knew pretty quickly it wasn't that one, but still, it's just to be that close, we're just like, no, it's kind of funny. I found it funny, at least.
Well, I will say too, with that individual, like we were saying, I hope that they share the lotto love here locally. If not, though, some of our restaurants are really getting a lot of love, as we mentioned on Friday.
Yes.
The Dave Portnoy from Barstool Sports, he was in the Detroit area because, of course, Friday online betting went live here in the state of Michigan. But he also posted on Twitter about the Coney dogs, and he had like American versus Lafayette. He's a pizza guy, and he's like, I don't really like, wouldn't be my first choice either one, but he picked American Coney Island as the winner. And of course, we've had Grace here on the show. And what that means for them is people are doing online donations to help them survive during this pandemic, which is always great. And it's just a little bit of public love. And I think the last time I checked, it was up to like 15 grand that was being raised for American Coney Island. And so again, just as a reminder, we know that so many of these restaurants have been given the green light to reopen on the 1st, but still, when they open at 25% capacity, for some, it's not even going to be enough to really kind of cover some of their operating expenses. So to see something like this makes you happy. And let's hope the lotto winner, if they are from here locally, I mean, you could have been driving through and just or maybe you're an out-of-town visitor, going to the Kroger. I don't know. But let's hope that they share some of that love with our restaurant industry as well.
Yeah, hopefully they will. $1 billion is a lot of money, and to be able to help other people in your community after coming into a windfall of cash like that would be a great way to start your new life as a billionaire in the local area. And for those that may be considering traveling through the Metro Detroit area, I can't think of a better Kroger to venture through to get your lottery ticket than the Novi Kroger.
With that, but if we could shift a little bit, obviously huge sports weekend here. Matt Stafford leaving the Detroit Lions. I don't think that's really a big surprise for a lot of people. But on top of Stafford leaving, we had the Lakers.
Yes.
They won their big state championship, but sadly we are also hearing that Coach Bellamy is going to be leaving to go to the University of Michigan.
Yeah, that was reported just a few hours after the victory on Saturday. The Lakers defeating the defending champion Davidson Cardinals 41-0 in the state championship game. A few hours later, reports started surfacing that the University of Michigan was parting ways with their offensive line coach. They were going to rearrange their offensive assistant coaching pool, and part of that was that they would be bringing in West Bloomfield head football coach Ron Bellamy, presumably to be in the wide receivers coach's position, and they would rearrange others otherwise in order to fill the now vacant offensive line coach position. It was initially unconfirmed. It was that way all the way through the remainder of Saturday night and all through Sunday, and then this morning, Coach Bellamy did release a statement thanking West Bloomfield for their years of support to him and to this football team as they were building that program, and that about confirms that he is going to be moving on to the University of Michigan. We'll do our best to get Eric Pierce on with us, the athletic director at West Bloomfield High School, see maybe where that coaching search will go. Is it going to be somebody from within the program like defensive coordinator Tyrese Grice after the season that defense had? He's got to be somebody that's being heavily considered for the head coaching job. Similarly, Ken Reese, their offensive coordinator, has had a number of great years coaching guys like Donovan Edwards, guys like Taj Mustafa and A.J. Abbott and Lance Dixon, or three players that had a lot of offensive success at West Bloomfield that are now at Big Ten schools, or do they look elsewhere? But regardless, Coach Bellamy put in a lot of years of great work here in West Bloomfield, developing a great football program and a lot of great young men as well, and we can't be more thankful to him for sticking around through all that success and seeing things through to a championship, and we wish him a bunch of luck at the University of Michigan, except, of course, when they are playing the Michigan State Spartans, in which case, sorry, Coach.
Tyler, I will say, I saw a picture. I think it was you or Civic Center, someone tweeted you and Dave Scott, because
Yes.
You were at the game, and you were grinning ear to ear.
Oh, of course.
I have long told you, Tyler, you need to be doing sports. You're a very valuable asset to Civic Center TV and the entire organization here, but you need to be doing sports. But on top of that, I also wonder if you would have won the lotto, would you have even quit? Or would you just keep
Not on
doing
that
what
day,
you're doing?
no.
Or would you then just maybe go ahead and start up your own sports broadcast, kind of like Woodward Sports is doing, right?
That's something I'd have to. That's something I could certainly have. I certainly considered after buying the lottery ticket. I'm just like, what I would do if that came to fruition. I wouldn't have quit the day. I wouldn't have quit my job on the day of the state championship game. Let me just say, all these Fridays and sometimes Saturdays, sometimes both, that we've given up over the years to broadcast West Bloomfield High School football, having been so close right there with the team all those years, I would have definitely stuck around to see that through. And plus, I knew we were winning the game when the MHSAA told us, when the replacement for John Johnson at the MHSAA, who retired just recently after we spoke to him, John Ross, his new replacement there, the director of broadcast operations, after he told Dave Scott and I that we were going to be broadcasting from the visitors' radio booth at Ford Field, I knew it was over, because West Bloomfield obviously is going to win. Everybody wins as a visitor at Ford Field.
Well, with that though, Tyler, I will say I don't think you would even quit if you were a winner because
No.
you like being here at Civic Center TV. Plus, we always give you something to complain about every day. I mean,
Sure.
come
I mean,
on.
but like,
Who
I'll find
wants to
something
be
in
happy
anything.
all the day?
No, no one
Every
wants to.
day's
I complain for comic relief. If I'm truly frustrated with something, you'll know it'll be very obvious. Usually, I just complain to get a laugh out of people, and it works. It works very well.
Well, I will say if I bought that ticket at that Kroger, I would just be like, oh, I was so close. Oh, I was so close. It wouldn't diminish my dream though. I'd go back and I'd keep purchasing a lotto ticket. I'll be interested, Tyler, if that individual purchased a quick pick or if they had numbers that they played all the time. And did they just buy one ticket? Because this is the debate in my household. I will buy one ticket, a quick pick, or I'll buy three, one for me and one for my husband and one for the dog. My husband has this huge plan and numbers and this, that, and the other, and I don't know what he does. I'm like,
My system
look,
is if I do quick pick, it's all out there in the ether, and I can't control it. So that's why I went with on this one. Like, you know what? It's probably better I don't control this one because I'm the kind of person that just slips on the proverbial banana peel half the time and makes a mockery of myself. So that's what I went with for this particular one. But if I'm picking the numbers, whatever comes to my mind first. Whatever comes to my mind first, those are the numbers that you go with because if you're thinking of it, there must be some reason you're thinking of it. So.
well, I know a lot of people had a lot of dreams this past weekend, but you know what? Look, we'll just start over with those dreams and start a little bit lower. I'd be happy with just $1 million. Hey, I'll take it.
I think most people would.
With that, though, let's go ahead and jump into the headlines. Like we were just talking about sports. Ron Bellamy is going to be going to the University of Michigan program. But on top of that, right now, they're having a bit of a tough time, Tyler, because Michigan athletics going to be shutting down for the 14 days beginning yesterday because of confirmed cases of the COVID-19 variant. B117, which transmits more easily and can lead to more positive cases. So this is according to an order from the Michigan Department of Health and Human Services. There have been positive cases of the COVID-19 variant from numerous individuals across different teams. That's according to an athletic department spokesperson. So all sports in season, that includes men's and women's basketball, will be affected, including practices, training sessions, and games. Athletes, coaches, and team staff have been ordered to isolate starting this past Saturday until further notice. It's unclear how the pause will affect scheduled games beyond February 7th, but Tyler, the game impacted in between this time, Michigan State.
Yeah, unfortunate for Michigan. Talking a lot of smack to Michigan State about that particular basketball game. Not gonna have a chance to show it up. That being said, not entirely surprising that we have these kinds of outbreaks. A lot of shared facilities between sports teams at every university. We've had these problems at Michigan State as well. We've had them at all the universities in our state. It's not just the University of Michigan, just happens to be at this point in time. Unfortunately, numerous individuals across multiple teams, as has been reported by the athletic department's spokesperson, as he wrote in that article on our website, going to shut them down until at least February 7th. And then hopefully from there, they're able to have some clearance to get, if not some of the sports, then all those sports back up and running. You feel for the athletes, those that are infected and those that aren't, for having to shut down their seasons. We know from our high school football coverage how tough it is for these athletes to put so much of their hard work and energy into preparing for their games, into preparing their bodies for athletics, and having to shut that down for a period of time due to COVID-19. It's been one of the constraints of sports in 2020 and so far in 2021, and it doesn't make it any easier for these athletes when these incidents do occur.
So Friday, Tyler, we were able to bring the governor's press conference live here on Civic Center TV, but I don't know if anyone noticed at the time who wasn't there, and that is
Yes.
Robert Gordon, the director of the Michigan Department of Health and Human Services. He has been a key figure in the state's response to COVID-19. Well, he wasn't at that press conference on Friday because not long after that press conference, he announced his resignation from the Whitmer administration. Gordon gained the public spotlight after the Michigan Supreme Court ruled back in October that Whitmer had violated her constitutional power by continuing to issue executive orders to combat COVID-19 without the approval of state lawmakers. The governor's administration quickly shifted to using orders issued by Gordon under the Public Health Code to require masks be worn, as well as impose the restrictions on public gatherings and other situations, obviously including the closure or the restrictions in many of our restaurants and other businesses as well. So he did send out a tweet, though. Gordon tweeted, "It's been an honor to serve alongside wonderful colleagues. I look forward to the next chapter." Within 20 minutes of Gordon's post, Whitmer's administration announced that Elizabeth Herzl will become the new director of the Department of Health and Human Services. She served as the senior chief deputy director for administration for the department. Read between the lines here, though. This is going to be interesting to see what happens going forward, because normally, especially this guy has been in the middle of a pandemic. Like, this hasn't happened in our country in 100 years. And then he resigns, and there's no, I think Whitmer's press release had one line: "We thank you for your service." Normally, if someone in that situation was going on to move on, maybe hire to DC or to another position, it would be accolades and this, that, and the other. That did not happen. So it's going to be interesting to see if it comes out behind the scenes why he did, in fact, actually resign, and if it had anything to do with the governor lifting those restrictions starting on the 1st. I think, too, politics are involved here. Tyler, as you know, I used to work for the federal government,
Yes.
and while it was a law enforcement agency, I can tell you there are a lot of politics in all government jobs. And a lot of it is called, people look out for covering their own butt, per se.
Oh, yeah.
But with the Flint administration, when it comes to the health or the Flint debacle, a lot of these health departments have been put on alert that they're not going to let politics play into their decision making, because look what happens or could happen if you do. So I am extremely interested to see how this plays out here in the next coming months.
Yeah, there's going to be a lot of questions. There already are a lot of questions about why this happened, why so suddenly. How far in advance did the governor's office know about that? Did they have someone in line? Did they maybe ask former director Robert Gordon to resign from his position? I'm sure that's all going to come out in the coming weeks as more people look into this, as more people ask a lot of questions, dig into sources within the governor's office and within the Department of Health and Human Services, and maybe the governor will even address it directly at one of her press conferences. I would think that would be a lot less likely than the other scenarios.
Also, just to let people know, almost 300 additional members of the Michigan National Guard, they are going to be deployed to expand the COVID-19 vaccination and testing efforts here. The additional soldiers and airmen will assist the Michigan Department of Health and Human Services administer the vaccine and test for the coronavirus. Including the new addition, there are now over 600 members of the Michigan National Guard deployed here in the state. As of Saturday, the Michigan National Guard has administered almost 32,000 vaccines to residents. Vaccination and testing teams are comprised of one National Guard medic, 2 support personnel, and really the purpose of bringing them in is to help the Michigan healthcare agencies have the personnel to deliver the vaccine, and they will also be helping to set up some of those mass vaccination clinics. I know that they were at the show place in Novi over the weekend for Oakland County, assisting with the vaccination happening out there as well over the weekend, Tyler.
Yeah, having extra people, having extra hands in the state to help with the COVID-19 vaccination and help with testing gives some relief to those in the medical community, and some relief in the issues that have led to the little bit of lagging that we've had, the major lagging that we've had to some extent since the COVID-19 vaccines were first released. Hopefully this helps the state of Michigan catch up to the previous pace that they were hoping to be at in vaccinating people of Michigan in a methodical way. And if that help comes from the National Guard, then it's certainly going to be welcome. And hopefully the National Guard will be able to continue to focus on this in the state of Michigan and won't have to be deployed elsewhere for security purposes, as we've seen in recent weeks, because this is happening in Michigan. It's certainly going to be something that we're going to see in other states throughout the union, and the National Guard is going to be playing a key role in the vaccination process, especially with President Biden's goal of 100 million vaccinations in his first 100 days in office.
Yeah, let's hope that they're treated a little bit better than they were in DC. I don't
hopefully.
know if you saw the story that kind of happened is that after the riots at the nation's capital, they were sleeping in the Capitol in between shifts and this, that, and the other, and then they were banished to a parking garage that didn't even have cell service or a bathroom. And then once it went public, all of a sudden all of our elected leaders said, oh, no, we're sorry, come back. And now they're starting to put up our guardsmen and women in hotels there in the DC, and we thank people for that. And that is the power of the media, though.
Oh, yes.
And that's the good use of the media. So we want to let everyone know, as a quick reminder, you can always get the latest headlines. Go to civiccentertv.com, click on the coronavirus tab. That's where you'll find the latest headlines, but also direct links to some of the agencies so that you can do some of the research and so you can follow along as to what's happening, as well as some of the numbers. It changes all the time for yourself. So we're going to take a quick break here on the Megacast. When we come back, we have a great lineup for you today, but on the backside of the break, we'll be speaking with the professor and chair of philosophy over at Oakland University. They have a big event coming up tonight talking about the vaccine, and there are so many conversations to have around this vaccine, and we will start off the show speaking with Professor Mark Navin when the Oakland County Megacast returns.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask.
Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together. Together.
For the latest information, visit oakgov.com/COVID. The only way to beat COVID-19 is to face it.
You can't get too
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Great to have you with us on the Monday edition of the Oakland County Megacast. Just as a reminder, Tyler and I are here Monday through Friday, 10 a.m. until noon, bringing you long-form interviews with decision makers, policy makers, and other individuals as we all continue to try to navigate the COVID-19 crisis. I'm excited to bring in our next guest. We've talked with you once before, but I think in 2021, the focus on the COVID-19 crisis is really turning to the vaccine. With us now on the show is Mark Navin. He's a professor and chair of philosophy at the Oakland University, but you're also a lecturer in foundational medicine and medical studies at the Oakland University, William Beaumont. Always great to have you with us. Thank you for being with us.
Thanks, Ronnie. Glad to be back.
So tell us, if we can just start off, I did tweet out and share the information about tonight's event. So fill in everyone about the event and the panel and why and how this came about.
Well, so we at Oakland University are really delighted tonight to host some medical and public health experts to help answer people's questions about COVID vaccine and how effective and safe it is, and also when people can expect to get it, and some of these more complicated sort of political questions that you were talking about in the earlier segment that are affecting us all. So we've got Dr. Bagdasarian, the senior public health physician with Michigan Department of Health and Human Services, Dr. Faust, who's the health officer for Oakland County, Dr. Gilpin, who's been sort of running a COVID vaccine for the Beaumont system. And we've got Reverend McDonald, who's the lead pastor at Prospect Missionary Baptist Church in Pontiac, who's going to help us think about some of the community issues that we're working on in promoting acceptance of COVID vaccine and really coming to terms with the way that COVID disease and our attempts to manage that disease have ravaged our communities and our sort of hopes for entering the vaccine era, which we're taking our steps into in a really exciting way.
Professor, I love that you're putting on this event because this is not just a one street conversation. There are so many different factors that go into this. And even just talking about the different cultural issues and how the public or how the government is going about trying to share this message of why people should get vaccinated in different communities, because people receive the information differently, but also we have various issues from the past that come into these, some being religious, but also, the government has not always been trusted from members of the Black community, and we can understand that.
Well, so vaccination, as you say, is not just a matter of facts and figures of science, but it's a matter of social and political and historical facts about how we go about making decisions and living together. And you're entirely right. It needs to be a two-way conversation, and the community voice needs to be central in promoting vaccine acceptance, because ultimately vaccines aren't something that sort of are done to people, but that the community decides to do to itself for its own reasons.
Why do you think we're getting so much of a pushback on this vaccine? Because vaccinations are not new in our country. They've been around for years. In fact, I just saw a commercial for, the HPV vaccine, which was fairly new a few years ago when it came out. So why are we starting to see some of this pushback, do you think?
Yeah, I mean, maybe I'd want to reframe the question a little bit. I don't think we're seeing a lot of pushback. I think we're seeing some hesitancy, and that's normal. But so what we really are seeing is amazing demand. So some of the healthcare systems that I've consulted with and other organizations, they are overwhelmed with demand for this vaccine. People want it and they can't get it. And that's really the issue right now. It's true that some of the healthcare providers who were offered in those sort of first weeks of phase 1A decided to defer the vaccine. But almost all of nurses and physicians got it. A lot of people who defer, this is one story people haven't told, that it's often been reported 30 to 40% of healthcare professionals deferred the vaccine. Those numbers were highest among the environmental services workers, like your janitors and the food service workers. The nurses and the doctors, almost all of them went and got it. And that difference by service line breaks down in some of the sort of race and socioeconomic status and sort of trust differences that you appealed to before. But I would say the real story is demand and scarcity and hesitancy, which isn't necessarily refusal, but a real natural wait and see approach, which is usually, in many cases, the right thing to do. When something is very new and no one you know has done it before, very few of us want to be the first person to do things. And I sometimes think when I talk to friends in the media or in the academy that, look, we are people who choose to go into media or into the academy or into medicine are often people who are doing things that no one else in their family has done before. Right? They're often like risk takers in that way. And I think most people aren't like that. And it's entirely reasonable for people to want to feel that people, they look around and see that people like them are doing something before they do it. And so I don't think that's pushback. I think it's taking some time. And I keep hearing these stories that, hey, because I was worried a little bit in December, maybe in January, but now I'm seeing all these elderly people waiting in line or staying on hold for 2 hours or driving around to try and get to these clinics, maybe this is the right choice for me now that I'm seeing so many other people trying to get this vaccine.
I am going to say I'm happy to be at the back of the bus on this one, because by the time it comes available to the general public, we'll really kind of start to understand and see some of these issues. But on top of that too, we've had an ICU nurse on that she had the vaccine, and she said, if people have seen what I have seen over the past 10 months, they would not hesitate to get this vaccine. But the vaccine also, for it to work for our community, to bring us out of the back end of the pandemic, we need buy-in. We need people to get this.
Well, and I think the way you get buy-in is often slowly. So I'm someone who, I have a lot of trust in institutional science and in physicians. And, one reason for that is I'm especially privileged and don't come from a tradition and culture of distrust and abuse and oppression. But I think it's entirely reasonable to think that buy-in takes time, and it's something you have to proactively cultivate. So I think actually people in public health know this very, very well. I think that sometimes those of us who get sort of angry about the so-called anti-vaccine people want to say, well, why don't you agree? Why are you resisting? Why aren't you buying in? Well, actually, it's public health's job to sell vaccine to people, and they're doing a great job, right? America gave 1.4 million doses last year. Every day, yesterday or so, every day we're giving more doses. The trend lines are all good. There are these real concerns, but I see them largely evaporating for people as time goes by. And so obviously there's work to be done, but I would frame it's work that public health is doing and that has a responsibility to do, rather than that there are people who have any sort of blameworthy hesitancy or refusal at this point.
So, Professor, I'd like your perspective on this next question, in that a lot of people, I think, that maybe wouldn't have gotten the vaccine before, but now, in order to really go through society, they work in industries that they're being required to get the vaccine if they want to be able to do certain things or visit certain customers if they're in the sales industry. And I think eventually it's going to get to the point that in order to go to like a football game in a stadium or something of that nature, we're going to have to show that we had the vaccine or we've had a recent COVID-19 negative test, which kind of poses its own questions because we know testing hasn't been 100% accurate. What are your thoughts on the requirement of the vaccine to be able to do things in our society?
So it's a good question. And so I think normally when we think about vaccine mandates, we're talking about children going to school. And so we're already on different turf here because we're talking about adults. And normally when we talk about vaccine mandates, we're talking about vaccines that have been around for decades, right? And given millions and millions of times. And this is a new vaccine. So we're on two sort of different grounds, talking about adults and a new vaccine. So I think that the closest analog is seasonal influenza vaccine mandates. And we have those. People work in hospitals or congregate living situations often have that mandate. But we have it because tens of thousands of people die of seasonal influenza every year, and some people are at heightened risk of either getting it or transmitting it. And so I think it's entirely reasonable in the short term for us to think about some COVID vaccine mandates. I'm wary right now to be putting too much attention on that because really the issue is scarcity. Really, the issue right now is not we've got a lot of people that don't want it and we're trying to force it on them. The real issue is we have a lot of people who want it and we can't get it to them. And I would much rather we spent our time focused on getting the vaccine to people who want it and prioritizing, thinking of reopening in those terms. So for example, some school districts, some states have been thinking about reopening in terms of making sure teachers have already had access to the vaccines under phase 1B. And before even considering reopening. And so thinking of not as a mandate, but as a sort of access before you open up rather than a mandate before you open up. But I think it's reasonable to think about mandates down the road, but I just don't think they're our sort of primary issue.
I love the, I even forgot about some places requiring the flu vaccine. I worked at plenty of places where they have pushed it on you, where they were like, if you didn't get it, they were like sending you an email, hey, you missed your blah, blah, blah. And I was like, no, I know. Because I will say I don't get the flu vaccine. And that's just a personal choice. And I think that's one of the issues people have. But also when you were saying, when it comes to the scarcity right now, we were putting so much hope on this vaccine. But at the beginning, it's like I look at the rollout of this and you hear, because the politicians will get up there and they'll speak and they sound great for a 10-second soundbite. But the reality of actually getting people in, getting shots in the arm and rolling it out, it's totally different. And you wonder, like, too, about how many is going to be produced. We cannot expect everyone to get it at the same time. And I'm looking at the rollout. What are your thoughts and your perspective on how this vaccine is being rolled out to the public? Should we have waited? If we're going to mandate that schools go back in session by March 1st, should we have put teachers at the top of that list to get the vaccine?
So a lot of great questions there. Fortunately, I'm not a politician, so I get to say whatever I want about this. So I would say there's a sort of macro and a micro issue. From the macro point of view, the United States, vaccinating 1.4 million people per day and more every day is a success story. And if that line keeps going up, all to the good. And if you look at internationally, we're actually doing okay. There's some countries like Israel that are doing a lot better than us, but we're actually doing better than most countries. That's not to say that we're doing great, but comparatively, I think we're doing pretty well compared to most other countries. The rollout has been a mess for a variety of reasons, and that have been well discussed. So lack of clear communication from the federal government about when vaccine was coming or what vaccine there was, lack of coordination and direction to the states, and then states making decisions that perhaps you know something about in Michigan to defer some allocation prioritization decisions to local health departments and to the healthcare systems. So I've definitely heard people complain that, well, at Henry Ford, such and such group of people can get the vaccine, but at Beaumont, only the other people can get the vaccine. And at here, you have to call, and here you have to show up, and here you have to email. And I think these mixed messages and different allocation schemes of who goes first when can be at the very least confusing and can certainly seem unfair, even though, at least in my experience, all the local and state health department people I talk to and all the healthcare system people I've worked with are trying to do the best with what they've got, but it's a deeply broken system. So that's the general point. On the teachers, it is the case the teachers are very highly prioritized. So they are towards the top of phase 1B. So phase 1A was the one we basically wrapped up. That's the healthcare providers and the long-term care facility residents and workers. Phase 1B is now the 75 and older. In Michigan, there are two top groups in phase 1B, 75 and older, and the prioritized essential workers who are engaging in sort of sustained contact potentially with people who have disease. And teachers are in that. So teachers are in that phase 1B. So I would say that they've been quite prioritized from the point of allocation.
So what is your perspective or your thoughts on the change of the presidency and the new Biden administration? How is that going to change the conversation around vaccines, do you think?
I don't know. I mean, I'm waiting to see. Here's what it doesn't do. It doesn't overnight make millions of doses of vaccine appear, right? The doses are what they are. I'm hopeful that there's going to be increased communication and transparency, but politicians are politicians, so who knows about that? I'm hoping that there's going to be greater sort of guidance and coordination, but we shall see. I mean, the real issue is we need vaccines and to put them in arms, and we don't have enough. I don't think a change of administration immediately helps with that. I mean, maybe down the road, right, with the Defense Authorization Act, maybe depending on how FDA responds to the Johnson & Johnson application, maybe if we ever see the AstraZeneca vaccine come to FDA, maybe that's a difference. But I think we're in a wait and see approach right now with the change of the federal administration.
This kind of takes us back to where we were with testing in the beginning, right? Like you couldn't get a test because there is a process to go through. It's not a light switch that you can click on and everything's available that you need. 10 plus months into this pandemic, and I'm just now able to find Clorox wipes pretty steadily on the store shelves. Lysol spray is still kind of out there, but on top of that, you look at some of these other countries, this is not the first, it may be the first pandemic for the United States in the past 100 years, but other countries have also gone through some of these pandemics. I watched a recent documentary about the Ebola outbreak, and you look at that and you're like, oh my gosh, it like wakes. You're really wondering like why we weren't more prepared for this, watching what other countries went through, but they did the same thing. They shut down schools, they shut down businesses, and you understand once we're now going through it and it's impacting us on a day-to-day basis what they went through. So what do you think is going to be the conversation with the public from your perspective, because you're a piece of the puzzle and there are so many pieces of this puzzle to be able to help bring this pandemic to an end?
Yeah, I mean, so here's big picture how I think about it. The purpose of having a government, I don't care if you're Republican or Democrat or Libertarian, the purpose of having government fundamentally is to keep us safe from predictable serious harms. And we generally as a society do a pretty good job of planning to keep us safe from war, right? America's got a great military, and we are on a sort of preventive footing, right? Prepared to with contingency plans and resources to fight all kinds of conflicts. We do a much worse job being well-funded and prepared to protect our community from disease. But disease has actually killed more human beings than war in the history of humanity. And it's predictable. We know it's always coming. And there's a nice analogy with military as well. In the early history of America, we didn't have a standing army. Every time there was a war, we would mobilize for the war. Eventually we realized, hey, that takes an awful lot of time and inefficiency. We should have a professionalized warfighting class that is just always prepared and fully funded to go and do that work. And I think we need to get to the point as a community where we think the same way about public health. We know diseases are coming. We need to fund and prepare and be ready. And we're not. I think we're it's a reactionary when it comes to disease. And it's been a bipartisan problem. I mean, I think when it comes to cutting funds, right, it's certainly, more on the side of the Republicans, but even Democrats, I think, have not been as proactive as they should be in thinking about the ways disease can ravage our communities.
Because we've had professionals on the show before, and they're saying, hopefully this is the last pandemic that we see in a while, but there are other possibilities out there. The threat is always out there. It's about how we are preparing for it and our response to it as well.
Yeah. And I think that's a cultural political change for the country. Do we see public health as just this kind of extra thing that is fat on the bones that we can cut when times get a little rough, or do we see it as a centrally essential function of government, much like we protect military funding, because we know that kind of national defense is so essential?
It's been it's such a crazy time in our country over the past 10 months. But I think the good thing that comes out of this is it does start to open up our thoughts and our minds and our process to some of the things that are going on globally. Other parts of the country or the world have been experiencing this prior to just COVID-19. So hopefully this continues the conversation and education as well, which is so important. So Mark Navin with us, he's the professor of chair of philosophy at Oakland University. Hey, Professor, can you tell us again, I know the event tonight is free, but people need to pre-register. How can they do that?
So that's a great question. I just sent to your producer, Lawrence, the URL on Eventbrite that they can register for the event to spend time with Dr. Bagdasarian from Michigan Department of Health and Human Services, Dr. Faust from Oakland County Health Department, Dr. Gilpin from Beaumont Health to talk about, and Reverend McDonald from Prospect Missionary Baptist Church Pontiac to talk about vaccine for COVID in our communities and moving forward. But there is a URL to register, and I don't have an easy way to share it with you on live TV.
That's okay, though. Just to let people to know as well, our Facebook partner, Oakland University today, but also I posted that information about the event tonight on my journalist page, so you don't have to be a friend of mine. I never understand why Facebook limits people to 5,000. It's just crazy. Like, you shouldn't have to. But you can find it on my journalist page as well. Really a fascinating conversation, and we appreciate you and all of the people over at Oakland University putting this together. But I am excited. You guys have a lot to cover in just an hour, though.
We're going to try and stay very disciplined and focused on people's questions about the vaccine and when they might get it and how it works and any concerns they might have. We want to make sure we address those in that time we've got. We have over 300 people registered, which is for us a pretty big Zoom event. So we're pretty excited about that.
Well, that's awesome. With that, anything quickly I didn't ask you that you want to add in before we let you go?
I mean, I'm just always happy to have the opportunity to say that the Pfizer and Moderna vaccines are safe, some of the safest vaccines we've ever seen, amazingly effective, and that people I know in Michigan are doing the best they can to get you access to that vaccine as soon as they can. So
I will say, I'm one of those people, like I get woozy, even taking my dog into the vet and seeing them put the needle in to pull the blood. So I'm not a needle person. I'm waiting for the Johnson & Johnson. It's a one needle vaccination, and hopefully that's going to be coming on the market soon.
Very soon. Dr. Fauci said maybe in 2 weeks it'll just come to FDA. So we're crossing our fingers on that.
Fingers crossed. I'll take one needle poke versus two any day.
Fair enough. Thanks, Ronnie.
Well, thank you. And again, thank you for putting on the event tonight, but you can find more about the event. Vaccination Access, Awareness, and Acceptance is going to be a panel. They will be speaking tonight, 6:30 to 7:30, and you can get a link. You do need to pre-register. Thank you so much, Professor, for being with us.
Thank you so much, Ronnie. Take care.
We're going to take a quick break here on the Megacast. When we come back, we'll be speaking with Paul Wells, the Fire Chief Emergency Manager for the Birmingham Fire Department. They are willing to step up to start administering the vaccination, but will they be able to do so? That's next on the Oakland County Megacast.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/containcovid.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Great to have you with us on the Monday edition of the Oakland County Megacast. As a reminder, you can always watch and listen to us on Civic Center TV. Catch us on Birmingham Area Municipal Access. If you do have cable, tune us in. If you have Comcast, it's channel 15. If you have AT&T, it's channel 99. And you can also listen to us on the radio if you're out driving around, 89.3 Lakes FM, 88.1 FM The Biff. And again, we want to say thank you to Oakland University for allowing us to live stream today's edition of the Megacast on their Facebook page. And with that, let's continue the conversation around vaccines and other first responder situations with Paul Wells. He's the Fire Chief Emergency Manager for the Birmingham Fire Department. Great to have you with us. How are you?
Good. How about you?
That's quite the title you have, to be a fire chief and an emergency manager.
Yeah, it's the title. The second part there, I never thought I would have to really partake too much in my career, but then, COVID hit and here we are.
I was going to say, I hope they're paying you double salary, but knowing how local government works, I doubt that. But still great to have you, and I'm sure that they appreciate having your perspective in both jobs.
They do, and it definitely helps me to be a better fire chief, knowing a little bit about emergency management as well.
So with that, if we can just start off with the conversation, we recently did report that you said, hey, you're holding up your hand. Your department is ready to be able to administer the vaccination to the residents of Birmingham. Your response and where do things stand right now?
Well, yeah, correct. When this hit, we were following, the pandemic when it was overseas, and when it came to the United States, we had a plan in place, had the PPE that we already had here for the fire department prior to being being more involved with emergency management. So as soon as we got our hands on changing our SOPs to address this pandemic, we thought, what would we do next? And that was, well, one day there'll be a vaccine available. So we acquired what we thought would be enough to handle most of our most vulnerable, 65 and older, 50 and older. So we acquired 5,000 syringes and needles. So if there was a shortage, we would have those to start administering the vaccine. And then as we saw, there was a couple companies coming out to market with 2 doses. We over doubled that to 11,000 to allow us to vaccinate 5,500 residents. So we've had this plan since April of last year, but we wanted to wait till the vaccine rolled out. And once it rolled out, verbally, we had conversations with the state and let the county know we wanted to do this. But once it was out, we wanted to put it in writing just so, hey, here it is. Here's our plan. Let's try to have address any issues you might see. So one day when the vaccine is more available, we can jump in and help vaccinate our most vulnerable here in our city.
Chief Wells, you might want to look out because you're thinking ahead, which it seems that some people in our elected leadership may have trouble doing. We seem to be turning on a dime with this pandemic. We also know that the information is changing daily as well. But with that, great insight and forethought by you and members of your team. But at this point, you just simply can't get the vaccine.
Yes, that's correct. But back to the insight, hearing Professor Mark there just talk. I mean, he's great. And he hit the nail on the head. A lot of people are reactive when things happen. And like he said about the, armies, building armies, whenever there's a conflict, emergency management has talked about pandemics forever. This is something we train for. We talk about hurricanes, you talk about natural disasters and pandemics. Our emergency response plan for the city has talked about preparing for a pandemic, having every resident have 2 weeks food and water in place. This is something we've had for our residents to see on our webpage for years. And we print a manual every year that we give out at our open house. So unfortunately, when you have politicians, or just what you said, they're politicians, not all of them are trained in emergency management or be a firefighter, police officers. So that is an insight that it wasn't just my idea. It's because we get trained in it, and we can kind of see things like this happening. As far as where we're at, I believe was your question. We're waiting still. We have not been told a firm no or a firm yes. There's progress being done behind the scenes where they're gonna. I think one day they would use us and then use our model to give out the vaccine here in Oakland County to other fire departments. All the fire departments that I work with on a daily basis, they're part of Oakway. That's 10 different fire departments that are part of Oakway. We are all paramedics, our departments. We're all trained on how to give IM injections. So given a vaccine is given just a normal injection that we could do, our medics could do in the field every day. So there's really no specialized training. The only training that would be is if they need us to dilute the vaccine, which the Pfizer one does need to be diluted. That's something, again, we are trained to do. Our medics are willing and ready to participate in.
I've been a reporter in this area for 15 plus years, and this is the first time I'm hearing about Oakway. So see, I learn something new every day on this show. So thank you for sharing that. And one of the big issues kind of has been that they've talked about overwhelming the healthcare system and taking away people to work on the front lines to administer the vaccine. But there are other avenues if they open it up, is basically what you're saying. We're here and we're trained and we can do this.
Yeah, absolutely. We already give out 150 flu vaccines to our city employees every year. We've been doing that for 25 years. We're one of the only cities that I believe in the area that does that. And the reason was it's so cheap to do that, and you can save on sick time. You can save on having especially when it comes to the fire department, we're around people with the flu all the time. You can save having a firefighter spread that to their family. So this program is nothing new with vaccines. We're prepared to scale it up. So.
So we have seen some of these drive-through services. So do you have a plan that's already kind of laid out, just waiting so that if they say, hey, you're a go, you're ready to go? Would it be a drive-through service like we're seeing at other entities throughout Oakland County right now?
Yeah, absolutely. Not at first. The first thing we need to do is I have 2 senior living complexes where our seniors have been basically sheltering in place for the last 10 months. They would be the first place we would go to. We've already reached out to their staff. We helped them with testing. We helped them with PPE over the last year. They would be our first stop because they're in a concentrated area. And a lot of them don't drive, but they're not long-term care facilities, so they're not on a priority list right now with the county. They're not a nursing home. They're independent living. So we would first go there. We could use their staff to help out as we did with testing. They would help us out. So it would require less Birmingham City employees in the first phase. Then our third stop would be our senior center in town here. We have a privately ran senior center. They have 800 Birmingham seniors that are part of that. And they've already done a survey. And last week I spoke to the supervisor there, and they're at around 200 plus people that want us to administer the vaccine at their center. Again, it would be done safely, spread out. They did flu vaccinations with a private company this fall the same way. And they can also have access to busing, so they can get to those seniors that live independently at home and get them to the center for us. It would be an option that would make the most sense before we went to drive-through. And then we would switch to a drive-through process here at our main. We have 2 fire stations in Birmingham. We would do it at our main fire station. And we would do that 5 days a week for about a 5 or 6 hour window. Again, depending on how much vaccine we could get. That was with the parameters. If we were able to pick up the vaccine thawed from Oakland County or somewhere else in Southeast Michigan, we could get the vaccine to our site and administer it before it went bad after being thawed. So we're very flexible in the fire service. I mean, that's how we roll. I mean, you can't predict these emergencies. You can kind of predict what kind, but we're able to roll with the punches and make it work.
With that, also when you're talking about the logistics, like it seems in talking to you, like you're going, okay, here's plan A, B, C, D, E, and F. And one thing we've seen about the vaccine, it is about logistics, especially with the Pfizer vaccine that has to be stored at the super cold temperatures. So when it comes to that, would you be looking at that vaccine, or would you say, no, we only need the Moderna vaccine at this point in time?
I can make anything work. Like I said, if it's the Pfizer one, I can have a runner be there right at the freezer door when they hand us our 100 or 50 doses a day, get it to our site, and then have everyone lined up ready to go. If you just communicate with us, just like the call center, we're prepared. We already made our own spreadsheets and scheduling, and we've had a couple of meetings with my staff, other city staff, to beat up how we can organize a schedule, what we would do if someone doesn't show up, how we can get out a instant alert to our citizens and say, hey, 5 people didn't show up, contact this number. We have a form made where we can, get that registered ahead of time. The only thing we're not doing is we're not doing a waiting list right now because we can't dedicate. We don't want to have people give people false hope too. We keep telling everyone, please sign up for Oakland County. Go to their website. We refer them on our city website to go to the Oakland County Health Department, sign up, go anywhere else you can. So we're prepared to take anything we can get. We can make it work. We can adapt very quickly.
Because we have heard these heartbreaking stories where some of these vaccines are going bad because maybe people didn't show up or they didn't use them for whatever reason, but they're only good for so much time. But this is about logistics. And one thing when it comes to first responders and people such as yourself and the firefighter in the EMT world, it's about being prepared to respond for the unknown.
I agree. It is. And the one thing I want to, I think that's missing is right now there's a mass testing site in Novi, and that's great. You can get a lot of people, but what if you live in North Oakland County? I mean, that's the closest, that's an hour drive, to get somewhere. We need to have more sites. So I understand there's a shortage. I do. When we released our plan, this is when we thought there was going to be more release in the federal government, and that didn't happen. So we're willing to, we get that the county is in a hard spot, the state's in a hard spot. My plan is to have a plan, though. We work out all the bugs. If there's some legalities, like I even had our city attorney draw up a waiver that the city would be, good to go if there's anything happening. We talked about how we would have that waiver filled out safely. We could download it online and just, give us a copy with the site. We tried to figure out all this ahead of time. And I think the county, when they have done their drive-through services, like that's where our firefighters went through, they did an amazing job. But we just want to have more sites and provide to our citizens the resources I think they deserve.
Yeah, Paul Wells with us here on the Megacast. He's the fire chief and emergency manager for the Birmingham Fire Department. And with that chief too, I worry about members of our senior citizen community because we're just assuming everyone is online. And they are such a great population that they're not online, even despite everything that's going on in this pandemic. They can't just go online and click to make that appointment. And so I think your plan in trying to reach out to these seniors is such a vital plan that should be shared with other departments across the state and the country as well, because eventually we are going to be able to hopefully get enough of this vaccine.
Yeah, and our plan, this should be a plan that's always in place. I know when you're talking earlier, there's as people are hopeful there's not another pandemic. This pandemic might be around. This might be a yearly thing. We don't know enough about the vaccines out there and these variants coming out of Europe and South Africa. This might be the norm. So you're going to need to have fire departments to help out. You're going to need cities that don't have a fire department that are trained in ALS to, invest in the fire department to help out. Because every time there's a hurricane or there's an earthquake or there's now a pandemic, emergency services are looked to take on more. And you need to have that infrastructure in place. You can't do a mass hiring in the middle of a pandemic for firefighters. It's just tough to do. So you need to have a plan. We'll use this plan again in the future, I'm sure. Unfortunately, the world's getting smaller with everyone being able to travel, and travel costs are less. So this is going to be nothing new. So the hopefulness of this pandemic is we learn a lot from it. And the next one that comes around, which it will, unfortunately, I hate to be, the blue, I like to be the blue skies happy, but I feel like every time I have my staff meeting weekly with the rest of the departments, and I feel like I'm the Debbie Downer person, and I hate it. It hasn't been fun, but with this is why we're excited as a fire department. Our firefighters are stressed out. They've seen a lot of negativity from people getting sick and dying from this virus, and we're fortunate because our city's done very well compared to other cities, but it's had a toll. So this is our time for redemption. The firefighters are excited to partake in this. Everyone's willing to put in the extra time and hours. And I hope this is something that happens.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. Just another minute with you because I know we're running a little bit behind. But Chief, if I can ask you, some people would immediately say, is this going to take away from the services that you already provide?
Not at all. Not at all. We will, there's going to be some little bit of overtime here. We have, firefighters stepping up that would do that. We have the services here to do this. It's not just the fire department. The firefighters are going to be used for standby, the paramedics, in case there was an adverse reaction, which is very, very low chance of that. It's a very safe. Both these vaccines that are out are very safe. But we would have 2 paramedics that would be drawing up the medication and giving it. The rest of it would be city staff. We would have clerical work helping with the documentation and sending that to the county. We would have police officers helping with traffic and security, parking enforcement helping. So this is a city service thing where each department would give a couple people a day to this program to make it work smoothly. And like I said, with the senior centers and the senior living complexes, they're going to use their own staff. So our services here will remain the same the whole time. It'll just be better.
Well, Chief, we so appreciate you coming on and talking about this. And you know what? One thing that comes out of this, you mentioned how we prepare for such things as hurricanes and other natural disaster events. And hopefully from now on, pandemic is going to be added into that conversation at a higher level, because I don't think anyone is going to look at this differently coming out of the pandemic, which means at the end of the day, maybe entities such as yours will get the support that you need.
Hope so.
Well, thank you for being with us. Paul Wells, he is the fire chief and the emergency manager for the Birmingham Fire Department. We have a lot to get to here in the second hour of the Megacast. When we come back, we'll be speaking with the superintendent for the Lake Orion Community School District. boy, you want to talk about a challenge right now. We'll be talking to him, but as the students return to class. This is the Oakland County Megacast.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
Or blue. But one thing we can all agree on to help stop the spread of COVID-19, wear a mask.
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 The ball's in your court, Michigan.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
We want to say thank you to everyone that tunes in to the Megacast. As a reminder, you can always catch us Monday through Friday on Civic Center TV, Birmingham area municipal access. But if you have cable, thank you, because a portion of your fee helps support the Cable Commission and programming such as this. So Channel 15 if you have Comcast, 99 on AT&T. But if you're out driving around, you can also tune us into the radio, 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. We want to say also thank you to Oakland University for allowing us to live stream today's edition of the Megacast on their Facebook page. And speaking of schools, what a challenging time, but it is a new year and a lot of schools are already starting to welcome their students back into the classrooms. And to talk a little bit more about what's happening in his district, Ben Kirby, the superintendent for Lake Orion Community Schools. Thank you for being with us.
Thank you. I appreciate being here, and thanks for having us.
So we talk with so many various superintendents throughout Oakland County. Every single district has a different plan but I believe your students returned on the 19th. Is that correct?
That is correct. We do have the in-person option for all students, all levels. We have multiple programs running, but yes, everybody started again last week.
So when you say the in-person option, I know there are some hybrid programs going on as well. Fill us in on the details of that.
So when I say in-person option, I'm referencing those students that chose to come into the school buildings and receive their instruction and their learning, with their teachers. We run a Dragon Virtual program as well. And we've been running the Dragon Virtual program all along. That has run concurrently with our in-person and remote option. Our in-person and remote are together as one option. Our Dragon Virtual is a second option. Really, the Dragon Virtual is a program that allows families to have consistency because they would be in this program all year long, and they wouldn't be as impacted by the ebbs and flows that the pandemic has created. But as far as the in-person option, we do have multiple things going on. Would you like me to explain how our students currently are in the in-person option?
Yeah, because elementary is in person, but it's afternoon, like morning, afternoon. But then at the junior, do you have junior high school, and then their part days? How is that working?
Yeah, so we're doing something that's a little bit unique compared to what others were doing. And we're doing that based on what we learned when we had our students in person in November. We were privileged to have our students back, actually, our elementary students, we started back, I believe it was October 25th, and we had them in the in-person option for 3 weeks. And then we had our secondaries join them in the month of November, and they ended up being in for 1 week. But during that point in time, that allowed us to learn what some of our successes and challenges were for the in-person instruction. And we learned that there were some issues at the elementary as far as classroom or the lunches. When students were eating lunches, those were exposure issues, which, we recognized that going in, but then had some strategies and whatnot. But because of the number of students, at that point in time, we were serving over 80% of our students in an in-person option, and the ability to, get the social distancing, we looked at that as one of the issues. So when we brought students back, we made some changes with that. One of the other things that we recognized is that when we had our specials teachers go from room to room in our elective classrooms, that created some exposure issues. So if one of those elective teachers, say, was COVID positive, then they potentially could impact 3-4 classrooms. All those classrooms would have to go to remote. So what we did is we looked at how can we try to provide the most continuous schedule for our elementary students. And we did that by looking at a morning session in person for those that chose the in-person option. So what that means is our elementary students get a 4-hour and 15-minute morning session, and they are in person, and the focus is on the core and IEPs for those students with IEPs, but the focus is on the core. And then students would, as they leave, we'll use Monday, for example. So they leave on Monday at approximately 12:15 or 12:45, depending on if they're an early start or a late start, which, we had to manage all the busing and everything too. But when a student leaves on a Monday afternoon, they get their lunch for that day in a grab and go setting. So, a paper bag, lunch to go if they choose to get lunch, but they also get their breakfast for the next day, for Tuesday. So they grab, 2 meals, they go home either through our transportation or their own family transportation or their walkers. They go home, they eat their lunch at home, so we don't have the exposure potential at school. And then in the afternoon, we have in their Seesaw accounts some independent activities that they can do with their family. So they can do those immediately after lunch, they can do it before lunch, they can do it at 7 o'clock at night. But it gives some autonomy to families as to how they want to continue the education. And so the afternoon session is a remote, and it's asynchronous, and so they do that with their families. It's the specials, and it's social emotional learning that we're putting in their accounts.
Ben Kirby with us here on the Megacast. He's the superintendent for the Lake Orion Community School District. With that, speaking with you is fascinating to me because I'm thinking about behind the scenes. What is it like for you and members of your staff to even try to remotely come up with such a plan? It's
tremendous work. I mean, we're 85% of what we're doing is managing and leading through this pandemic and making sure that we're coming up with programs that can provide consistency. And that's really what we're trying to do with what we're doing. We're trying to put together a program as we moved forward here with the information that we've learned from our experiences and other districts around us, how we can keep people in school in the in-person option. So that's really why we're doing what we're doing. And we really hope that this is the minimum and that we will only move forward from here. But the amount of teamwork has just been exponential. I've got a great team that I work with, not only the leadership team, what we call our cabinet, those, my assistant superintendents, but our principals and other teacher leaders. I mean, people are continuously communicating. I've got a communication cycle that I do weekly that I'm sure we'll talk about here. But it's just constant. It's talking about the successes, it's talking about the challenges, and also what are some of the silver linings of this pandemic that we want to make sure we don't lose. So when we have school in 2 years from now, 3 years from now, we continue to use some of these things that are become best practices that we never even thought of, prior to the pandemic.
Because I am thinking about what would these conversations have been like pre-pandemic if you went to, your families and your students and members of the union to say, hey, we want to start doing this online program. I would imagine they would have thought you were crazy at that time, right?
Pretty much. I'm pretty convinced they think I'm crazy now, but it has allowed us, this pandemic has allowed us to jump over some hurdles that we probably wouldn't have leaped before. You know, and our teachers, our staff, our support staff, everybody's just been wonderful. This has just been a really trying time, and our community's been great. I mean, certainly there is a tremendous mix and a divide as to who wants in person and who thinks that, the virus, is going to be transmitted in schools and who doesn't. But the teamwork has just been amazing, and we have accomplished some things that, 3 years ago, if you told me we were going to be, providing, Dragon Virtual in the format that we're doing, I would have said, probably not. Maybe in 5 to 7 years if we really are aggressive, because schools are traditionally slow to change. It's pretty traditional in most school districts.
But with that, we are here and we are having to make some of these changes. But as you mentioned as well, it's about consistency. Are you worried about being able to provide some of that consistency as the students return to in person during the pandemic? Because what if we have another surge?
Sure. So as far as worry, no. As far as make it a focus, yes. We really try to. So what we did with, our structure, and we've really only talked about the elementary, but what we did with that structure is we removed some of those times that were causing us to have to switch back to remote, meaning learning from home with their teachers. So it's been very intentional with what we've been doing. We're taking small steps. We're doing it in that way so that we don't have to work our way backward, outside of MDHHS rulings or, the governor telling us it's going to take a lot of operational interruption in order for us to switch back to a remote. In November, when we had to switch back to a remote setting from our in-person setting, at the end of that week, we had, I believe it was 17 classrooms that had to switch full classrooms back to a remote setting. After this last week that we just did across the district, we've had 2. In November, we had 80 some staff members that were in a quarantine issue. This particular time we're at less than 10. So things are better. And so I don't worry about it, but we do think about those things as we plan forward.
But with that too, right now, the focus right now is about the vaccine. And there are some school districts across the country that the teachers are basically saying, we're not going back into the classroom until we have the vaccine. What is the conversation there at Lake Orion regarding your teachers and support staff with the vaccine and also their availability right now to be able to get it, because we do know it's scarce?
Sure. And, we're just flat out blessed with our labor groups. Everybody's trying to figure out how we can provide, in-person instruction, Dragon virtual instruction the best that we can with our students. We certainly have staff members who feel it very important for them to have a vaccine for their health and safety. We don't have a formalized, group that's saying we're not going back into the classroom until we get the vaccine, because we've been working. My human resources and our teaching and learning assistant superintendent meet with our teachers union group on a weekly basis, and they're talking about issues, and they're part of the decision making, and they've made some recommendations to help us think of how we move forward with students. And then I meet with all the labor leaders on a monthly basis, and giving them updates and getting feedback from them. So with that continuous communication, it has really helped us stay on the same page and make our steps forward and try to reduce our steps backwards. So just blessed with our labor groups.
Yeah, we've all learned that communication is key throughout this crisis, even when that communication is, we don't know. At least you're, sharing that you are still trying to figure things out with the rest of the team as well. Ben Kirby with us here. He's the superintendent for the Lake Orion Community Schools. And, superintendent, before you go, I have to ask you, a big snowstorm is on the way. Students are now going back to the classroom. Are snow days going to be back on the menu now? Or is it like, nope, it's a snow day, virtual class is the way you're going?
Yeah, so big is relative, right? As far as the snowstorm. So we have a weather call later today to hear from a meteorologist as to the impacts in our area about that. But as far as snow days, one of the things people need to understand and realize is that when we have I'll use our Dragon Virtual, for example, that's the program where kids are learning, via the computer and the teachers are on the other end, but they're not coming in. They're not in person, but a lot of that staff is coming into the building to provide their lessons. So they still have a travel issue if there is inclement weather. But what we're looking at is the idea of a traditional snow day is still there because we've got travel issues, whether it's in person or it is, the Dragon Virtual teacher going to teach from their classroom. What we do have that we will be looking at is if we know there's a impending storm coming, and we can with certainty with the weather forecast, approximately 36 hours or more, we know that storm is coming, then I'm comfortable switching us to a remote setting for the designated days that it looks as though we're going to have hazardous weather. I'm not going to do that in the morning and say, hey, we're going to do remote on, like Wednesday morning. I'm not going to say we're going to do remote for today's lessons because the weather's poor. But if on Monday afternoon, it's very clear by 3:00 that Wednesday is going to be a tremendous travel issue, then I'm comfortable with making Wednesday a remote day. So that's how we'll proceed. And we're actually going to send out some communication to our families today to clarify. As you mentioned, there's some pending weather this evening going into tomorrow, just so that everybody's on the same page. But like tonight's issue, it's going to be we're going to be up with the roads 2:33, 4:00. We have different people doing different areas of the district checking to see, but the traditional snow day is still alive and well, but it's going to have a companion with the remote.
Well, thank you for that perspective, because this is something so many people will be wondering, but also questioning as well as the snow comes in. With that, Mr. Kirby, he is the superintendent for the Lake Orion Community Schools. We so appreciate your time. Maybe I didn't touch on anything that you want to add before we let you go.
I guess I would just mention too, when we talk about the snow days, that every district makes their own decisions. So not everybody's going to operate the same way as we are with the remote. They may or may not look at that option. We feel compelled to try to get as much education as possible for our students, certainly within that pandemic. I would also want to mention that we've had great community collaboration. I've got a local medical group that I've been meeting with on a weekly basis that's been giving me feedback about the students and the families that they're servicing and how our programs are impacting them. And then, certainly I've got a group of teachers I meet with on a weekly basis. So communication has just been at a very high level, and that's really helped us. And so, we're very blessed in our community that people understand the importance of education and not a lot more to interject other than that we do have all of our secondary students in a hybrid format. We didn't really touch on that. The hybrid is basically every other day. Students are coming in person, and on those off days, they're getting asynchronous or independent lessons from our teachers.
So many facets to this conversation and the education process as we continue through this crisis. Superintendent, we so appreciate your time.
Thank you. I appreciate being here. You have make it a great day.
And I will say, we wish you and your team the best of luck because, hope is on the horizon. We're still in the middle of this crisis. And I know that you and the superintendents across the state and Oakland County have been working countless hours to try to come up with solutions to a problem where really there are no solutions right now. You're just trying to do the best you can.
Sure. Thank you very much. Appreciate it. Take good care.
We're going to take a quick break here on the Megacast. When we come back, the orthopedic surgeon will be speaking with him, as well as talking about some of the issues coming up right now in the sports medicine industry, but also you as an individual because of the winter weather months. This is the Oakland County Megacast.
Hi, I'm Dr. Faust, the medical director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
We want to say thank you for taking time out of your Monday to be with us here on the Megacast. You can always catch us Monday through Friday, 10 a.m. to noon, Civic Center TV, Birmingham area, municipal access. If you have cable, tune us in, channel 15 on Comcast, 99 on AT&T, but you can also check us out on the radio, 89.3 Lakes FM, 88.1 FM, the Biff. And we also want to say thank you to Oakland University for allowing us to live stream today's edition of the Megacast on their Facebook page. And for the rest of us, right now today, we had this winter wonderland. It was so pretty yesterday watching the snow fall. But with that, in the middle of the winter months, there are a lot of issues that can come with that as well. Dr. Ronald Lederman with us. He's the orthopedic surgeon and sports medicine doctor for the Center for Orthopedics and Sports Medicine. And good doc, we were talking before during the break. I have a big dog, and being able to walk the dog, you don't realize how many injuries could happen because of the ice that is out there right now. And when you have a dog that pulls you, I have taken a tumble or two recently, and it's not so pleasant.
It's not uncommon either. I can tell you, interestingly enough, my daughter, who lived in Chicago, had an orthopedic injury, needed knee surgery, and this was 2 days after she got an English massive puppy. So already this puppy is 35, 40 pounds, big and strong. And so we've had a trainer that told us that you hold the leash and then wrap it around your wrist so you keep it not a lot of slack. These big dogs, when they want to go, they can yank your arm out. My sister-in-law, just 2 months ago, walking her dog, like she has done multiple times a day for 10 years, same exact thing happened. So you're right. With this gorgeous snow comes hazards. And whether you're just walking to the car, into a building, people are slipping and falling, and they're sustaining shoulder fractures, ankle fractures, wrist fractures. The only good news I can say is that Lederman-Kwartowitz Orthopedics will get you in the same day. You just call the office, and if someone says, I fell and I think I broke my knee or my wrist, you don't have to go to the emergency room. You can come right to the office.
And see, I would never think to call you first. I would think, oh, I need to go to an urgent care or to the emergency room. But really, and how common are some of these injuries during the winter months here in the state of Michigan?
Very common. I mean, every day between myself or Dr. Kwartowitz or Dr. O'Keefe, who's one of our orthopedic surgeons, Dr. Steve Hyman, who's in our practice. We're seeing orthopedic injuries every day. In the summertime, it's usually from sports, people out jogging. In the wintertime, and we've all seen it, we see people out there hiking on the trail, walking their dogs, probably more now than in the past because of this whole COVID fever. But we see it all the time, and we try and get the word out that, I mean, who wouldn't want to avoid a trip to the emergency room? Forget about COVID, going to an emergency room or a hospital where there are people with COVID, but why spend 3, 6, 9 hours when you can give us a call? We usually get you right in. You're in and out in probably an hour. So we pride ourselves on, like a boutique orthopedic practice where we take great care of everyone in a very timely manner.
But doctor, when do we know when to go to your office or even to an emergency care center? Because sometimes when you're out and you slip on the ice, it may not seem so serious in the beginning stages. You kind of get up and you're limping a little bit, but what should we be looking for to make that decision?
That's a great question. And if you have an injury, if the pain is like, oh my gosh, and you're on the ground and you're rolling and you're grabbing, more likely than not, you did something and it's worth giving us a call. And if nothing else, we bring you in, we get a quick x-ray, make sure nothing's broken. The more common scenario, like you just described, is, oh, I did something, but I'm not sure how serious it is. Maybe I'll walk it off, see how I feel the next day, and that's fine. And even the next day, if there's a lot of swelling, or if you can't put weight on it, or if you can't use your hand or straighten your arm or raise your arm, it's very reasonable to give us a call. We're a judgment-free zone, so there will be no judging. Even when, like my mother did 40 years ago, either with me or my brother, we hurt ourselves, you're fine, don't worry about it. And then a week later, we find out we had a broken bone. When she found out, she felt terrible, but, judge-free zone, no worries.
I love that analogy because there are times like you're like, oh, my wrist hurts or my ankle hurts. And you're always confused. Do you go in? Do you put ice on it? Do you put heat on it? Or do you just go to the doctor?
You want to ice it. If you have an acute injury, ice it, because that keeps the inflammation down. If even with the ice, you're hurting so much and the swelling is still there, give us a call, because even if it's not a broken bone, it could be a strained or partially torn ligament. And it might be something as simple as putting on a cast in the office or just putting on a removable brace. But you want to know, and it makes sense, and we're there to check it out. What I don't want people to do is say, I'm not sure, but I'll wait. And then sometimes we'll see someone that had an injury that needed attention sooner, which would have shortened the recovery. But when you wait so long, sometimes that window of opportunity closes.
Yeah, and the longer the injury, the bigger suffering that you're going to go through, but also the longer the recovery along with that. What's so hard too right now is sometimes when you go out and it's like that black ice and you don't realize that's on sidewalks as well. And so you need to be really careful at this time of year when you're going out. But beyond slip and falls, what other injuries or what other activities from some of these athletes are you seeing right now at this point in time?
Well, I'm part of a biking group, which is a wonderful community, which is based on outdoor activities, which we love. And now a lot of my biking buddies have gotten what's called fat tire bikes. And you'll see them on the West Bloomfield Trail or around, where they are, these big tires, almost looks like a mini dune buggy on 2 wheels. And people can go down. Whatever you do, you have to be careful. Of course, Pine Knob and Alpine, the different ski resorts are open. And common injuries are ACL tears of the knee, or if you fall and you go to grab yourself and you can hurt your shoulder. But you know what? At Lederman-Kwartowitz Orthopedics, we're big believers in getting outside, enjoying life, staying healthy and fit. And our goal is to, number one, get people better faster, which we do with our on-site physical therapy. They're incredible. We have alternative treatments like laser treatments, regenerative stem cell treatments, PRP, which is the plasma-rich protein. Tom Brady, who just got to his 10th Super Bowl, which is crazy. He made PRP, plasma-rich protein, very popular about 10 years ago when he did it on an Achilles tendonitis. So there's a lot of things we offer that have nothing to do with surgery. I mean, our goal at Lederman-Kwartowitz Orthopedics is to keep you out of the operating room. And that's truly the way we believe.
Hey, I know I've heard. Oh, no, go ahead. So, Doctor, you froze up just a little bit there, but will ask, I know some of my friends, when they've had some of these injuries, frozen shoulder syndrome and other such things, sometimes a steroid shot or some type of shot can help with those injuries as well, right?
Absolutely. So one thing we've done at Lederman-Kwartowitz is we invested in technology where we have an ultrasound machine that can go into each exam room, and we use the ultrasound machine to look at the rotator cuff to see if we think there might be frozen shoulder, rotator cuff impingement. And if someone has so much pain they can't raise their arm, we use the ultrasound guided cortisone injection to put it right where it needs to be. And it allows us to use a smaller needle. People love that. Small needle means you can't even feel it. And then we get them into our physical therapy, which is right there. That's the key. One piece of advice is if someone has pain in the shoulder in particular, but any joint really, and the pain is preventing them from using it normally, that can lead to a stiff or frozen joint. Don't sit on that. Come in, get evaluated, get a short course of therapy, and avoid what you alluded to, a long, protracted, and really uncomfortable recovery. Let's get people better faster, quickly.
And plus, that can help prevent surgery down the road as well, because I had frozen shoulder years ago. Like, I couldn't even lift my arm to wash my hair. It is so painful, and until you go through it, you don't understand what exactly it is. But physical therapy and some of these cortisone shots, the treatment is so important to help you avoid surgery.
Yes.
And with that too, so for people who could be klutzes, kind of like me, is there a proper way if you feel yourself falling? Is there a better way to fall than other ways, so that to help you prevent serious injuries?
You know, that's really interesting. In our physical therapy at Lederman-Kwartowitz, we have a gait training program, a gait stability, balance, anti-fall plan. And if someone's going down, the people that know how to fall the best are people that have studied judo. Because in judo, you're taught how to hit the mat and roll when you're flipped. So the most common instinct is to reach out with your hands, and hence wrist fractures. But if you know how to fall and roll and impact the fall, that is important. I'm not sure where I froze up earlier when we were talking, and I don't know if it was when I was talking about the non-surgical treatments like injections.
Mm-hmm.
I don't know how far I got or what you heard about the alternative forms of treatment, laser, plasma-rich protein, stem cell, and these are things that can help avoid surgery. And if you come to Lederman-Kwartowitz Orthopedics, every one of our doctors will do everything we can to keep you out of the operating room with all of these different alternative forms of treatment.
And it's about exploring your options. And doctor, with that too, can you talk a little bit about telehealth? We're hearing so much about that right now during the pandemic. Is your office offering that? Because how do you really do that with physical therapy?
That's what I was asking myself, but I'll tell you something really interesting. Yes, I think within 1 week of COVID hitting, we converted to telehealth as an offer. Now, we have taken such extreme measures for the past year to keep the office clean, safe, disinfected with the hospital grade materials. And we haven't had a single case of COVID that originated in the office or passed in the office, which is pretty amazing. I will say, so the short answer is yes, we do offer telehealth. I didn't think it would work with physical therapy, but some of the happiest patients were getting their therapy online with our physical therapy director, Jennifer Simmons, who, if anybody's been to our PT at LKO, they know her and her team. surprisingly enough, it works. It's really amazing. But I will say this, a real message of hope. I am so hopeful that now we are seeing the light at the end of the tunnel. I mean, we have not being political, but you can already see that with leadership working cohesively with people, the rollout, it's all going to be a team effort, which is so welcome. And I was at Ascension, Providence Health, getting the vaccine. At Lederman-Kwartowitz, just about everyone in our office has been vaccinated, at least with the first one. And to see everybody getting vaccinated, when was it we were saying, oh my gosh, we have to get through 6 months of the horrible Michigan winter? Well, now we're at a 2-month countdown. Meanwhile, millions of people or hundreds of thousands of people are getting vaccinated. So mark my words, in 2 months, come April, sun is shining, we're in the 40s and 50s, maybe 60s, hundreds of thousands, maybe millions of people are vaccinated. We're getting close, people, and it's working. But in the meantime, you can feel safe coming to us. If you prefer telehealth, we can offer that. And I think we're all going to get through this finally, once and for all.
Well, we are going to leave you on that message of hope. Your outlook is very infectious as well. So thank you so much. But quickly, before we let you go, good doc, can you also share with our listeners and our viewers how they can contact your office if they do have an issue? And also, keep in mind offices such as yours if you do have a spill on the ice right now.
Well, first of all, phone number is the best way. We have people answering the phones, live people, hopefully. It's 248-669-2000. 669-2000. And if you have an acute injury and you're really hurting, we'll do everything we can to get you seen that day if it's possible, certainly by the next day. And then Lederman-Kwartowitz.com or LKO.com, I believe. But the best thing is to call our office, 669-2000.
Well, Doc, I live on the West Bloomfield Trail, and we look for you riding your bike out there behind us. We want to say thank you for your time, and Happy New Year to you and your staff as well.
Thank you to you as well. Healthy, happy, and the sunshine is coming.
We so hope, right? We're looking forward to it. We're going to take a quick break here on the Megacast. Just about 20 minutes left on the show. And when we come back, we'll be speaking with the business education teacher and Deca advisor for the West Bloomfield High School. This is the Oakland County Megacast.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
We'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together. Together.
For the latest information, visit oakgov.com/COVID.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/contain-COVID.
Taking a time out of your Monday to be with us here on the Oakland County Megacast. You can always catch us on Civic Center TV, Birmingham area municipal access, as well as channel 15 on Comcast, channel 99 on AT&T. You can tune us into the radio if you're out driving around. 89.3 Lakes FM, 88.1 FM The Fifth. We also want to say thank you to the Oakland University for allowing us to live stream today's edition of the Megacast on their Facebook page. We also want to say, if you do have time tonight, tune in, go on, register for tonight's event. They're having a panel discussion regarding the vaccine. Before we leave you today, though, we also want to bring in Julie Zella. She's the business education teacher and Deca advisor over at West Bloomfield High School. Great to have you with us.
Thank you. Thank you so much.
Julie, my twin sister was in Deca in Ohio way back in the day, and I would imagine the program has probably changed a little bit since she was a member of that. But for those not aware of this program, what exactly is Deca, but also, and why is it important to have it in our high schools right now?
Well, actually, I was in it when I was at West Bloomfield High School, so probably might have been in at the same time as your sister. And what it used to be called was, DECA was a Distributive Education Club of America. Now we call it an Association of Marketing Students, because it used to be really a condensed of people that were just in the United States. But now it is in 9 countries outside of the United States as well. And it's an association of marketing students that compete at a district, state, and an international level for not only scholarships for college, but also for recognition for their high school districts, for the state in which they belong, and also for their country. And it's an association of 240,000 students at all the high schools, and they also have a collegiate level as well. And they compete in everything from sports and entertainment marketing to finance to hotel and lodging, an area of interest of theirs. And they compete in either a written project or a role play simulation or something that is going to be like a virtual business challenge online, something of interest to them that is going to help and them really kind of learn more about a career they might want to pursue. And they get a lot of knowledge out of it. They do 20, 30-page research papers. So it's very fun, very exciting.
A 20, 30-page research paper on top of your regular homework as well. But I will say the great thing about this, it's teaching the students about networking, which is so vital in their success in life post high school. But really, business community is all about networking.
Yes. It is. And we're so lucky that within our community, West Bloomfield and outside of it, but especially in West Bloomfield, that our business leaders and our community members will offer their expertise to come in and work with our students. They allow them to research their businesses, to explore them, even to work inside them or to work with them to learn more hands-on and what it takes to work and to pursue a career in there. And so they're learning a lot outside of the school as well.
With that, Julie, though, I also wonder, can you tell us a little bit more about how your program has been impacted during the pandemic and the COVID-19 crisis? Because for so many of these students, it's about internships, and so many companies have put internships on hold during the crisis.
So we traditionally were one of the largest, I think we actually are the largest club at our high school. So we have about 250 students of our student body that belong and join DECA as a choice of theirs. They want to do it. And so this year we have about half that amount that actually are participating, because it's hard to do doing it just through the computers because we've not been in the school itself. So that was one thing that impacted us. But still, with our 100 members or so that have done this, we've worked with them online. We've been able to do it virtually, and we have almost all of those 100 members who have moved on to the state level. So we still were able to get them to participate, working through virtual opportunities. And we were very fortunate that DECA offered them the opportunity to still contribute and work with these business leaders by using things such as Zoom and other ways to work with them with the written projects, to do a role play with them where they still work with those business leaders just in a different format, but still having those same experiences. So we just use different tools, but getting the same outcome.
So what do students need to do to be able to take advantage of this program?
In most schools, in our particular school, they have to be taking a co-curricular marketing related course. So anything from marketing to sports marketing to fashion to accounting to economics, anything that is a co-curricular course, they may participate with Deca. And it's the same situation for most schools across the entire country or the world, the same situation. And that is because what they learn in the class is what they need to know in order to do the competitions, and will give them the tools that they need to find success.
So what type of scholarships could a student potentially take advantage of after participating in the Deca program?
So they give out over $250,000 in scholarships a year. It actually ends up being a lot more than that. So 2 years ago, we have a student that got a $10,000 scholarship from Marriott, and so they were able to use that. In the past few years, we've had a number of students that have earned the virtual business scholarship. So they have ranged in cash from anything from $1,500 to $10,000 per person. And those allowed them to use those towards anything they wanted to towards college. They weren't limited in those. And that is because our students have ranged from first to third place in the world for virtual business. So they worked hard in that. And so those are like the top prizes in those. But then even more so, our students have had opportunities. They've gotten the opportunity to earn jobs and been guaranteed jobs once they get out of college. And so some of those are even more exciting.
Oh my God, that's like the most important thing. Julie Zella with us here on the Megacast. She's the business education teacher and Deca advisor over at the West Bloomfield High School. Has enrollment in your program been up or down during the COVID-19 crisis?
It's been up consistently for the past probably 7 or 8 years. This year it's been down with COVID. I anticipate it's going to probably go back up next year. But unfortunately, it was down just because so hard for some of the students to learn how to do this in a virtual environment. We did our best to try and make it work for the 100 kids that ended up doing it, our students, but it was about half of the students we traditionally have.
Yeah, but we also understand that these kids have to be zoomed out. You know, I sit here for 2 hours a day for this program, but then I'm taking a class on Tuesdays and Thursdays for an additional 2 hours, and that 4 hours, I'm like, oh my gosh, I just want to get off the computer. So for these kids and, students are doing amazing at adapting to this crisis and trying to learn the best they can. So even if they're not participating as much as they will, but it really is a great program for them to be able to try to learn these networking skills that are going to serve them throughout their lives.
Yes, we're very fortunate. We have some students that have gone on to do some really tremendous things and are really exciting, and we're happy to see them. And we have some superstars out there, so it's exciting.
So Julie, with that though, how has it changed for you to have to try to teach this program and advise this program as well?
We have really changed everything, I will say that. But we have learned so many tools, and some that we won't go back to the ways we taught before. Nearpod, these different ways of teaching, engaging students that are so exciting. That are ways to get the students involved that have really transformed teaching to see ways that we never thought were possible. And so I think that there are ways such as interviewing students and getting them involved that save time, that really we are able to find out more about our students and find out more what works with them. And I think some of those things are the things that we will take, even though we're going back like Thursday this week, we will still continue to use.
How do you think the business community is going to be changed by this pandemic? Because you are seeing so many jobs now posted, remote work available. Because before, so many jobs could seem limited because of the location. And now it seems like the world is opening up because remote work is now a possibility.
I think we're going to see a lot of work from anywhere. And I think that that's really an exciting opportunity for students. think where we saw a lot of, for all of us, I think where a lot of times we thought that you had to move from Michigan to be able to pursue a career, you could probably stay in Michigan. I also think we're going to bring a lot of people to Michigan that maybe thought they needed to move elsewhere. I was just talking to a couple businesses, and they are looking to come to Michigan because, it's less expensive to live here and they have opportunities. And they were asking if I knew of any former students that would be interested in a job. And I'm like, yes, I know some students that are graduating. That would be perfect. So I think it's going to be a great opportunity to get some big companies, maybe out of California and other places, to come this way.
See, it just opens up new worlds. There's always a silver lining. But with this too, I feel like do you feel like this is a full circle for you in your personal life? Because you were once a member of Deca and now you're advising, you're leading these students. What's this meant for you?
It means so much because when I was in high school, I had a mentor who was my teacher, and his name was Jerry Whitlock, who started the program at West Bloomfield. And he was a true mentor of mine. And then when I started at West Bloomfield, he was my mentor as a new teacher. And when he retired, I kind of took over the program along with a couple other teachers. And he was so influential to my life in so many ways. When I was in college, he wrote me letters and stayed in contact with me. We didn't have email and things like that back then. And my favorite part of my job is the communication. And I keep in contact through Facebook and other ways with so many of my students. They don't just leave and go out and graduate. And I keep in contact with them. Some of them are in 30s, they have kids, almost 40. And I love to see what they're doing, and we keep in contact. Some of them, I run into in the business world, and they come back and they help our students. And that's important to me. It's the communication and the relationships. And that's what this job comes down to. It's not a job, it's a career,
But you know what, though, that also says a lot about who you are as a person, that they want to come back and continue to reach out and to help the future students as well. With that, quickly, before we let you go, we have like another minute or two here left with you on the Megacast. What advice would you give to some of these high school students? Because one thing we are seeing too is there is a push for students to not necessarily go that traditional path of a college education. We need people in trade industries, but also in other industries as well, that maybe that traditional path that's been pushed for really hard for like the last 10, 15, 20 years may not be the right path for them.
I'm a very strong believer in taking elective classes, trying some things out that you wouldn't necessarily take. I don't think that there is a right path for every student. Some students are traditional students and some students are not. I think that as we learn more and more, there are going to be so many opportunities that are out there that you've never dreamed possible. So find something that you're passionate about, pursue it, learn more about it. There's not everything that you've always heard about. Not every student's going to have to go to college. There are trade schools, there are other schools that are going to lead to you to many possibilities, and follow your passion.
Yeah, I feel like some of these high school students, even at junior high, they're already saying, I want to be A, B, C, D, and E. And it was like, college was about figuring out what you want to do. I started out in international business. How I ended up then was like, okay, PR, and ended up as a reporter. It was never on my genre, but it's because college allows you to explore. And I feel like some of these students get on a path and they don't take these classes that open up their minds to what could be their hidden gems. So
a lot of times they get to college and they spend 2 years and then they go another path, and you got to explore and learn more. And there's so many opportunities now with everything that's happening in the world. So many opportunities are out there.
Well, we are so grateful for you and your time today on the Megacast. So thank you for what you're doing, and also, for helping to lead these students in a different direction, and putting them on a path of success. It's great to have you with us here on the Megacast.
Thank you so much for having me. Thank you.
Julie Zella with us here on the Megacast. She's the business education teacher and Deca advisor over at the West Bloomfield High School. That's going to wrap it up for the Monday edition of the Megacast. We say thank you for taking your time to tune into the show. Stay safe, stay happy, healthy, and happy on this Monday. This is the Megacast.